Hello guys, welcome back to Clinically Clear. So today let's cover biomedical waste management. Before we understand how do we manage and segregate biomedical waste, we need to understand what it is. So any waste that is generated due to four things: research, treatment, diagnosis or immunization of either humans or animals. Any waste from these processes, any waste generated is known as biomedical waste. We can broadly classify them into four types: infectious, pathological, genotoxic, and pharmaceutical. Infectious is the microbiological lab waste, the body infected body fluids. Pathological is think about all the stuff you'll send for pathological examination. Like after doing biopsy, you'll send some organs, you'll send some tissues, the fetus, basically the anatomical stuff. And genotoxic is the waste that has carcinogenic effect, teratogenic effect, mutagenic effect, like cytotoxic drugs, anti-cancer drugs. Pharmaceutical wastes are basically the expired and the discarded drugs. So this is broad classification. Most important is to understand the definition. Okay. Now from this definition, there are some exceptions or not exceptions, basically some important things to understand. Radioactive waste, that is x-ray films or whatever it is, not x-ray films I don't know if they're radioactive, but they're not radioactive, but radioactive waste, the management comes under Atomic Energy Act. General solid waste comes under the Municipal Solid Waste Management. Like you have the syringe, you have a new syringe, the plastic wrapper for that is just general solid waste, does not come under biomedical waste management. Hazardous microorganisms, examples genetically engineered bioterrorism agents, hazardous chemicals, they are also not biomedical waste. Then pacemakers, cochlear implants, these machine things in our body which have lead acid batteries, they are returned to the manufacturer. They are not considered biomedical waste. Important. Radioactive waste, Atomic Energy Act. General solid waste, Municipal Solid Waste Management. Hazardous chemicals, hazardous microorganisms, and pacemakers, cochlear implants, or any other such machine which uses lead acid batteries. They are all non-biomedical waste. Now, biomedical waste, you can have four colored bins. You can have yellow, red, blue, and white. Black is for general solid waste, general waste. It does not come under biomedical waste. So remember, black bin is not a part of biomedical waste. First, let's look at yellow bin. Yellow bin need not always be infectious. It can be either infectious or non-infectious. And yellow bin, it need not always be, a plastic bin. It is just 0.5 micron thicker than 0.5 micron, non-chlorinated plastic bag, which is yellow in color. That's all. That's all. Yellow bin is basically that much. It should be a plastic bag that is yellow in color, more than 0.5 micron thick, non-chlorinated plastic bag. Now, what you put in this, I'll tell you. You can remember it as category A, B, C, D, E, F, and G, H. Okay, for code category yellow. First is A. A for anatomical human waste, like the fetus, the organs, the tissues. These are all human anatomical waste. Okay, A. B. Animal waste. B is for animal waste. C. C for cotton. Apart from that, you have bandages. You have worn masks by patients or the doctors. Patient has worn masks. Doctor has worn masks. Those masks. Then you have micropore tape. You have casts. All these which have been soiled. Example: blood-soaked cotton, or some dressing, some wound dressing, ulcer dressing that you've done. You've removed it. Now you want to discard it. All those come under yellow C category. Soiled waste, also known as soiled waste. D for drugs, cytotoxic drugs and their equipment. Their IV sets. Examples: which are the cytotoxic drugs? The anti-cancer drugs. Now, anti-cancer drugs you will give IV. Okay, these IV set that gives the anti-cancer drugs, they are also a part of yellow D. Only for anti-cancer drugs. See, other drugs, general drugs, the IV set does IV sets, the IV tubes, they don't come under yellow D. They come under red. They come under the red bin. But for cytotoxic drugs and their equipment, it is yellow D. And even for expired drugs, yellow D. E is for chemicals. Chemical waste can be solid or liquid. So what's important to understand is in this yellow A, B, C, D, E. A for anatomical, B for animals, C for the soiled waste, D for drugs, and E for chemical waste. There's absolutely no pre-treatment required. You will just incinerate. Yellow for fire, fire for incineration. That's all. Simple. FGH is a bit different. F is for fluid waste. Okay, F is for fluid waste. Remember three fluids: X-ray developers fluid, the disinfecting fluid, and all body fluids except blood. X-ray developers fluid you will not incinerate, you will return to the manufacturer. Important point. Disinfecting fluid, like Harpic, Lysol, or whatever you use to clean the hospital floor, that is highly acidic in nature, so you won't straight away put it into the drainage. Pre-treatment is required. You will neutralize that disinfecting fluid and then you will drain it. That is for disinfecting fluid. And last comes all body fluids except blood, like CSF after lumbar puncture. I aspirate pus from an abscess, pleural fluid after pleural tapping. All those body fluids except for blood, they are also comes under yellow F, and here they require pre-treatment. Why? Because these body fluids could be infected. Pus from an abscess is infected, so the pre-treatment is disinfect these fluids with sodium hypochlorite and then incinerate. So F for fluid, it requires pre-treatment. X-ray developers fluid, return to the manufacturer. Disinfecting fluid, neutralize, then put it in the drainage. And all body fluids except for blood, disinfect with sodium hypochlorite and then incinerate. G for gowns, all the clothing stuff, gowns, mattresses, linens which have been soiled. Patient has slept on a mattress, the gowns of the doctors, surgeons, the mattresses. This also requires pre-treatment. You have to tear those mattresses, those gowns into smaller pieces, disinfect with sodium hypochlorite and then incinerate. Incinerate, yellow for incinerate. Understood? So gowns, mattresses, linens, tear it into pieces, disinfect with sodium chloride and then incinerate. Yellow H, H for hazardous biomedical waste. Don't consider this hazardous non-biomedical waste, hazardous biomedical waste. And four things: vial with live vaccine. You have glass vials with live vaccines, right? Example, some BCG vaccine. You have a glass vial with BCG vaccine and you want to discard it because it is expired. It contains live vaccine, so this comes under yellow H. Microbiological lab waste, like the petri dishes, the culture plates, they can be infected. Vacutainers with blood, important, not empty vacutainers. Vacutainers with blood and everything to do with blood. See, yellow F, all body fluids except for blood. Yellow H includes blood and blood transfusion equipment. That is, I did blood transfusion, whatever equipment I used for that blood transfusion, and I filled the blood which I transfused into a blood bag. That is also blood transfusion equipment. All this comes under yellow H. So vial with live vaccine, microbiological lab waste, vacutainers with blood, and everything to do with blood and blood transfusion. Blood also you will discard in yellow H. And here it of course requires pre-treatment. Either you do chemical disinfection with what? Same sodium hypochlorite, or you can do mechanical disinfection with autoclaving, microwaving, whatever it is, and then incinerate. So important to remember here is A, B, C, D, E, no pre-treatment, direct incineration. F, G, H, they do require pre-treatment, and F is for fluid, G is for gowns, mattresses and linens, H is for hazardous biomedical waste. Next, coming to red. In red, remember RPT, rubber, plastics and tubes. So rubber, immediately when you think of rubber, you should think of gloves. Every single glove, red bin. All gloves, red bin. Plastic, plastic bin, you should think of empty vacutainers, not vacutainers with blood, empty vacutainers. Syringes without the needle. I took out a syringe. Syringe has a needle. I use it for whatever I use. Then I detach the needle from the syringe. The empty syringe without the needle goes into the red bin. Intrauterine contraceptive devices goes into the red bin. Plastic done. Tubes, IV tube, Ryle's tube, catheter tube, urine bag, which is also like a dilated tube, right? Just try to remember it like that. Urine bag, all these are tubes. Tubes also are a part of that. Repeat, what does repeat make you think of? You repeat, you try to reuse it. So after disinfecting with sodium hypochlorite or mechanical disinfection in the form of autoclaving, then you will reuse, recycle or return. Repeat, you just want to repeat. You want to reuse it, you want to recycle it, or you want to return it. This is for red. And red is also the exact same. You need not have a red plastic bin. As long as you have a red colored more than 0.5 micron thick non-chlorinated plastic bag, it is considered as red. So remember, red for 0.5 micron thick non-chlorinated red plastic bag, rubber, plastics and tubes. So all the gloves, the tubes like the catheter tube, the IV, trials, urine bag. Then you have other stuff like IUCD, syringes, empty vacutainers. All this after disinfecting, you will reuse, recycle, or return. Next, coming to blue. Blue, how is the bin? Either it is a cardboard box with blue markings, or it is a puncture proof blue colored plastic bin. Puncture proof blue colored plastic bin or a cardboard box with blue markings. No bag or anything. Okay. Now, what do you do for this thing? How do you do is broken glass. So, what is blue for? Blue is for broken glass, empty vials, and broken ampules, broken vials, empty vials. Vials with live vaccine goes into yellowish. Broken glass, empty vials, broken ampules. Along with that, orthometallic implants, orthopedic metallic implants like plates, screws, pins, film, they put implant for the joints, stuff like that. That is all that comes under blue. So broken glass and metallic implants. Here also, after disinfection, we try to shred it, mutilate it. Disinfection is what? Chemical disinfection, sodium hypochlorite, mechanical disinfection, microwaving, autoclaving, whatever it is. We shred it, we mutilate it, and then we try to recycle. This is for blue. Okay. Cardboard box with blue markings. White is for sharps. What are all the sharps? Scalpels, needles, syringes with fixed needles. If a plastic syringe has a fixed needle, you put the whole thing in the white bin, not in the red bin. Even though it is a plastic syringe, there is a fixed needle. Then the blades. So all these goes into the white. Here what they'll do again, they'll disinfect it, they'll shred it, they'll mutilate it, and then they'll recycle it. Sharps. Because these are sharp, you can't put it in a bag, right? You need a translucent white puncture proof plastic bin for the white biomedical waste. Very important. Okay. White is for sharps, needles, blades, syringes with fixed needles, what scalpels, all that. Translucent white plastic bin, puncture proof. Black bin, as I told, for non-biomedical waste, for general solid waste, like the wrappers for syringes, leftover food by the patient. Patient has eaten some food. He says he doesn't want to eat the remaining food in the plate. Does that suddenly become biomedical waste? No. It is still non-biomedical waste, black bin. Masks worn by close contacts. If there is a close contact of, let's say, a COVID patient, then that close contact, should his mask or her mask also be considered as biomedical waste? No. Depends. If you observe that close contact for a period of 72 hours, no symptoms, no development of disease, then it is general waste, general solid waste in the black bin. Okay. Now, during quarantine, you're at home, you have a COVID patient, you have a lot of equipment, medical equipment, COVID patient is coughing out sputum, liquid, a lot of medical, biomedical waste is there. Do you have segregation? No, you're at home. So what you do is you take a double layered yellow plastic bag, double layered yellow bag, and then you put all the biomedical waste into that. Everything, liquid, syringes, expired medicine, whatever it is, put all the biomedical waste in a double layered yellow plastic bag and label it as COVID waste. This is for home generated COVID waste in quarantine. So quickly revising, what all is it? Yellow for infectious, non-infectious, where you have A, anatomical, B, animal, C, cotton, basically solid waste, D, drugs, E, chemicals, no pre-treatment, F, fluids. Fluids, you have X-ray developers fluid, and you have what? X-ray fluid, X-ray developers fluid, all body fluids except blood. Disinfecting fluid, G for gowns, H for hazardous, that includes vials with live vaccine, everything to do with blood, acutaneous with blood, microbiological lab waste. Red for rubber, plastics and tubes, you try to reuse, return, recycle. Blue for orthometallic implants and broken glass. White for sharps. And next, coming to how do we protect these biomedical waste handlers? See, they have to be immunized against hepatitis B and tetanus, first of all. Very common diseases that can spread through biomedical waste. And you should always give them personal protective equipment, like a semi-synthetic head cover. You should give them plastic goggles, a mask to wear. You should give them a gown. A gown can be a semi-synthetic gown or it can be a plastic gown. You should give them gloves to wear. should give them a semi-synthetic shoe cover, or should give them plastic boots. They have to have all personal protective equipment because they are handling biomedical waste. We don't want the handling workers to get affected through biomedical waste, to get infected, or to have any genotoxic effects or anything like that. Now, this personal protective equipment, where will you discard? Anything that is semi-synthetic, remember, goes into yellow. So semi-synthetic head cover. The mask I already told you goes into yellow. Yellow C for masks. Masks yellow. Semi-synthetic gown, semi-synthetic shoe cover, semi-synthetic head cover, all goes into the yellow bin. Goggles, which are plastic, red, RPT. Gloves, I already told you, red. Plastic gown, red. Plastic gumboots, red. Simple. Done. Then come into spill management. See, spill management can be of two types. You can have blood spill and you can have mercury spill. Okay. Now, blood is a biomedical waste. Yes, mercury spill is a non-biomedical waste, but mercury is highly toxic, hazardous, so we need to have certain protocol. Blood spill, what will you do? You'll first secure the area. You'll wear personal protective equipment. Then over that spilt area, you will place an absorbent material like a cloth, a newspaper, or a tissue, so that it absorbs all, soaks up all that blood. That blood could be infected. So next we'll add sodium hypochlorite solution over it, disinfectant, and leave it for 20 minutes. Once you leave it for 20 minutes, it becomes disinfected, and then again with cloth, newspaper, tissue, you'll clean up that area. Simple for blood. Secure, wear PPE, place absorbent, add sodium hypochlorite, wait for 20 minutes, clean it with the same absorbent. Blood spill. Mercury spill is a bit different. First few steps are the same. Secure the area, don't let anyone walk over it. Wear personal protective equipment. But remember, mercury, it splits into small beads, small drops, which run away helter skelter. They spread very quick. So you need to first find all the mercury drops. You should not use your hands to pick up the mercury drops, because it will split up the mercury into even more smaller pellets. So what you have to do is you have to use cardboard. Pick up the mercury drops with cardboard and add it to a glass container with water. Once you add up all the mercury to the glass container with water, cover that container and return that glass container with water and the mercury to the manufacturer. What manufacturer? Whoever manufactured that BP sphygmomanometer which had the mercury spill, the thermometer which had the mercury, the barometer which had the mercury. So many instruments have mercury. So whichever meter was manufactured with mercury, you have to just return to that same manufacturer. That is about spill management. Now remember, as I told you, biomedical waste generation is at the hospital. Segregation is also at the hospital. We are putting yellow, red, blue, white, black. We are segregating at the hospital. Once you collect it at the hospital, you should have a collection center in the hospital, and then it is sent to the Central Biomedical Waste Treatment Facility, where biomedical waste treatment takes place. Okay, and this is under control of the Central Pollution Control Board, which comes under the Ministry of Forest, Environment and Climate Change. So basically, CBMWTF or CBMWTF, Central Biomedical Waste Treatment Facility, is where it all gets collected. Now let's say there is some highly rural area where immunization is still taking place. So you will have vials, you will have syringes, you will have needles as biomedical waste. Deliveries are still taking place. Mothers are giving rise to babies. So you will have placenta, you will have dead fetuses. They are also biomedical waste. And there is no central biomedical treatment, medical waste treatment facility within the surrounding 75 kilometers. So what do I do with all that biomedical waste? Then there are two options. If it is anatomical waste like placenta, like fetus, then you have to do deep burial, where in a region where groundwater is more than 6 meters deep, then you should go 2 meters deep and bury the anatomical waste, leave it. So this is not very ideal because there is a high risk of infection spreading into the groundwater, but there is no other choice. There is no central biomedical waste treatment facility in the surrounding 75 kilometers. So that is why we have to do deep burial. And for all the other waste such as syringes, gloves, plastics, glass, all that stuff, you'll just put it into pits. These sharp pits are basically just 1 into 1 meter pits with a cover. You'll just put all the biomedical waste, you let it accumulate, you'll disinfect with sodium hypochlorite, and eventually someone from 75 kilometers away, some 90 kilometers away will come, pick up everything that is in the sharp pit, take it and go. So the temporary solution is in the form of sharp pits, but not for anatomical waste. Anatomical waste like fetuses, placenta has to be deep burial, has to be undergone, you have to do deep burial if there is no central biomedical waste treatment facility in the surrounding 75 kilometers. That is it for biomedical waste management. Thank you for watching.